We'll be talking about the basics of PA catheter. What is a pulmonary artery catheter? So pulmonary artery catheter is known as PAC, or your Swan-Ganz catheter, or your PA catheter. It's a specialized venous catheter that could give us a host of values related to cardiac function, hemodynamics, and perfusion. It helps us in evaluating patients with cardiac or circulatory disease process. The Swan-Ganz catheter is about 110 centimeter, and it's marked at 10 centimeter increments. There's a thermistor where we hooked up our Swan-Ganz catheter for thermodilution. There's the proximal injectates. The lumen terminates at 30 centimeter. That's where your central venous pressure is monitored, and your distal tip. The lumen terminates at the end. It measures your pulmonary artery. There's your balloon port. That's where we inject the air for a maximum of 1.5 ml. And there's your proximal volume infusion. Terminates at 31 centimeter. Here we're preparing for insertion. So prior to insertion, all the ports are flushed. As you can see, we are flushing the distal PA port, and that's the tip of the catheter where the fluid comes out. Then next, we're preparing for the CVP. The lumen terminates at the 30 centimeter. We also check for balloon inflation prior to insertion, and then hooked up your pulmonary artery catheter to pressure monitoring. Provider will be guided when it's ready for insertion. We can see here that we are inserting through the venous sheath. Usually pause at 20 centimeter where the balloon will be inflated. Usually at 13 centimeter, the tip just pass through the venous sheath. So once the catheter is passed through the venous sheath, it goes to your right atrium, and see here we could see the waveform of the CVP or your atrial waveform. Balloon is inflated and the blood carries through the right ventricle. The right ventricle, you could see that there's giant waves. It's usually created because there's very low diastolic pressure. So the diastolic pressure usually corresponds to your CVP. As it passes through and moved up, it goes to your pulmonary artery. As you can see, there's a step up in your diastolic pressure, and that's usually the closure of your pulmonary artery valve. Here again, when we insert the pulmonary artery catheter, you're on the CVP, and then there's giant waves. You're on your right ventricle. The balloon is still inflated at this time. As you push, it gets carried through your pulmonary artery. Again, you're going to see a step up in your diastolic pressure. It's just a confirmation that you are on the pulmonary artery. So when we insert the pulmonary artery catheter, if we pushed it further while the balloon is inflated, the objective of which is to wedge the balloon. Once it wedges to the distal pulmonary artery, it gets your pulmonary capillary wedge pressure. That's indirect measurement of your left atrial pressure. And it's deflated and left in place. After the procedure, a chest x-ray will be ordered to confirm placement. So usually at 25 centimeter, you're on the right atrium. At 30 centimeter, you're on the right ventricle. 40 centimeter, you're on the main pulmonary artery. And 45, usually the distal pulmonary artery, of which can obtain wedge. These are all approximation, and it obviously different from patient to patient, their height or their condition. We're going to talk about the Swan-Ganz catheter in relationship to the chest x-ray. So the ideal position of the Swan-Ganz catheter should be in the main pulmonary artery, right and left pulmonary artery, or the proximal interlobal pulmonary artery. If you place it distally, it could cause aneurysm or infarction. To locate the tip, you have to understand the anatomy. The two key anatomical elements are your pulmonary arteries and your pulmonary airways. So this is the normal chest x-ray. And those are your airways, your trachea, that's your carina, and it bifurcates to your right main and to your left main. Notice that the right main is shorter and more vertical. And that's the highlighted area where your main pulmonary artery is. And it bifurcates to the right and to the left pulmonary artery. It's very difficult to see that in the x-ray, so that's why it's very important to know where the pulmonary airways are. Just as a note as well, there's your interlobal pulmonary artery and your upper lobe pulmonary artery. Your interlobal artery goes vertically down. So again, your normal chest x-ray, and there's your airways that we will use as a marker to determine where is your main pulmonary artery, and it's highlighted there just below your left main bronchus and on the upper side of your left main bronchus. And that's where usually your main pulmonary artery is located. And that's your right pulmonary artery. And that's usually the highlighted area is your right main pulmonary artery. And this is your left main pulmonary artery. It bifurcates going down to your left interlobar. And that's your main pulmonary artery. As you can see, there's the left and the right pulmonary artery. Now superimposing the bigger rectangular area is your main pulmonary artery, in which usually the tip is ideally placed. And now it's superimposing your airways, and that's kind of the shape where your Swan-Ganz catheter is. Your Swan-Ganz catheter is towards the left of your pulmonary artery, about going to the proximal area of your interlobar pulmonary artery. So a lot of the times you could see this in the chest x-ray, that's kind of bifurcates towards the left. If it's pushed further down, it's going to have an angle going down because your left interlobal pulmonary artery goes down. And now we're going to look at the Swan-Ganz catheter. If the tip lies on your right pulmonary artery, that's in your right main pulmonary artery. Now if it gets pushed further down, then it goes to your right interlobar pulmonary artery. So it's kind of crosses the hilar area there. The hilar or the hilum is where it's like your root of your tree or your root of your branches of your pulmonary artery and structures. Now, if it kind of goes up towards the right side, then it's usually going to the upper low pulmonary artery. So the rule of thumb, if you want to check for the tip of the placement, it should be within the hilar contours, and so you could see those lines, and they're different Swan-Ganz catheter. The only exception is on your left interlobar placement, where it crosses the hilar contours, and that's kind of like the only exception there. So in order to correctly identify the location of your Swan-Ganz catheter tips, you need to understand your PA and airway anatomy and how they relate to each other. So ideal positioning is within the central pulmonary artery, which are usually medial to the hilar contours, and distal placement, particularly if prolonged, can lead to complications like pulmonary infarction or pulmonary aneurysm.